What are some of the tests that you need to do in your postpartum to ensure that your health is okay? What are some of the guidelines around exercise? Now, there's a lot of confusion in these areas because sometimes we get contradictory advice. So I'm here with Dr. Jayashree, who's a senior obstetrician and gynecologist. So this is women's health physical therapist talking to an OBGYN, and we discuss all of these topics to ensure that you're current on what you need to do in your postpartum to get back to your best health.
Yeah, that we are having problems with that again now because, most discharge summaries have a template which says, please come back in a week's time for, fix an appointment and see your doctor.
Okay. Yeah.
Well, actually speaking, there is no need for them to come back in a week's time. Now, most of them would come back to the hospital to see their pediatrician because, a checkup would be due.
Right.
Now, if they can schedule a visit along with that, well and good. But if the timings don't match or, they don't have to come a second time into the hospital, increasing exposure, just to see their obstetrician, there's no need to. They can call and tell them how they are, and we can schedule a postnatal visit even in 4 weeks' time.
Okay.
So there is absolutely no need to rush in after a week. But as I said, if they are seeing the pediatrician, that is important. They can combine it along with that.
Okay. And what are some of the checkpoints, doctor, at this first or 4 week visit? What are some of the things that you're looking for as far as progress with recovery?
Now, if it's a normal delivery, then we see whether the episiotomy has healed.
Yeah.
If it's a cesarean, whether the abdominal wound has healed. This would be the primary thing. And we ensure that they are continuing their iron and calcium tablets. And we also advise them to continue folic acid during breastfeeding. So all the three. Now, if they've been on any other medication, for example, thyroid tablets, then we ask them to continue taking thyroid. 6 weeks post-delivery, we check the thyroid values.
Okay.
And then for people who have been taking thyroid prior to pregnancy, we adjust the dose. For people in whom we have started the thyroid during pregnancy, if the values are absolutely normal, we ask them to discontinue.
Okay.
Now, other medications like anti-epileptics, etc., again, they have to make sure that they are taking it. If they've had high sugars in pregnancy, mostly after delivery, we would have stopped the insulin or the tablets.
Right.
So we ask them to go for what's called a glucose tolerance test 6 weeks post-delivery to make sure that they are not going to continue to be a diabetic.
Right.
So there are chances that they could continue. Or even if the sugars are borderline high, then we advise them on diet.
Okay. Doctor, so one of the things that I've understood is throughout pregnancy, immunity is low for mothers because the body's protecting the immune system from attacking the baby. But post-birth, there is a sudden, goes to the other extreme where the immune system is overactive. So can you talk a little bit about postpartum, endocrine disorders that need to be monitored? What are some of the red flags or signs that you need to be tested for maybe thyroid, postpartum thyroiditis?
Yeah, so hopefully, it doesn't happen often and it's not a routine recommendation or a guideline. But one thing that we have to keep in mind, which is not uncommon, is postpartum thyroiditis.
Okay.
Now, this is an autoimmune disorder. So if women come to us with, say, some kind of symptoms, then we definitely treat them. But as a routine, we don't look for free T4 or TSH postpartum just to look out for postpartum thyroiditis. But it is a recognized entity and we are on an alert to diagnose it, but we don't counsel the patients about it.
Okay. So what are some of the symptoms that you would have to look for?
Often they would come with a swelling in the neck, which is the thyroid gland swelling. That's the common presentation because the time is too short for them to present with hypothyroidism symptoms. Okay. So it is usually a swelling in the neck, sometimes a little lethargy, etc. can be, we can actually go through it.
One of the things that we find from a lactation perspective is consistent low milk supply also.
With the thyroid.
Yeah, because if the thyroid function is off, then milk production is,
then that could also be a reason, to test for it.
Right.
I think that's a feedback we should get from you.
Yeah,
We
it's
can
just
start
that,
testing.
yeah, it was an observation because a lot of times we try so many different ways to boost the milk production. And then if still consistently, then we look in, of course, the history of PCOS or, some infertility treatments, and then any kind of hormone, basically dysregulation. And then
Yeah.
thyroid becomes one thing. Um, and thank you so much, doctor. So that's been like really, helpful because we have some, understanding of the map to recovery in the postpartum. Can you talk about exercises in the postpartum? Of course, in physical therapy, we start right after birth. But can you talk about the general guideline that you use with?
See, with a normal delivery, yes, they can go straight on. And especially if it's somebody who has exercised earlier, then they're back on track again. Right? Now, where many a time somebody who has never done anything in their life, they suddenly started sweeping the house or trying to walk, or climb 2 flights of steps a week before their due date in anticipation of a normal delivery. Now, that's not exercise.
Right.
So we have to be choosy, have to individualize. Now, those who are into it, we have absolutely no problem. But those who are not, I don't like them to push themselves immediately because as it is, they have a lot of problem adjusting to timing, sleep, lack of sleep, breastfeeding, on-demand feeding. So there are so many issues. So in midst of that, if we tell them go and start exercising, that it doesn't work. Yeah. But pelvic floor exercises, they can definitely start. Correct. Muscle, the abdominal muscle tightening exercises, they can start. There's nothing wrong. Okay. But post-cesarean, I usually ask them to go slow on the abdominal muscles, etc., for a few weeks. Right. Because some of them overdo it, they come back with swelling, edema. So, because our patients, I think, are not tuned to it. But yeah. Those who have attended, these prenatal classes, yeah. So they have a very good idea of what to do, what not to do. Correct. So I ascertain their level of understanding and then allow the exercises. So it's not like a blanket recommendation for everybody.
Right. So even breathing in itself is an exercise in the postpartum.
Excellent. Yeah, they need that. Is if hopefully they should start doing it before their delivery itself.
Yeah. So deep breathing, even as you exhale and contract the deep abdominals, yeah. There is quite a bit of movement with that. Some arm exercises and all of those things that don't strain. But the unfortunate thing is, a lot of times people think that abdominal exercises is crunches and planks.
Exactly.
But, that is the problem where, yeah, that is the problem where we find that it pushes out too much against the stitches and maybe.
And there are always the so-called advisory committee comprising of neighbors and friends.
Yes.
Okay, so each one tells them what they think is right.
Yeah, correct. Yeah.
And
very confusing.
Your opinion doesn't hold water where that's concerned. So.
Right, absolutely. So it's that is true for a lot of things postpartum, including breastfeeding, because everybody has an opinion, and then it is very confusing for the new mother. Yeah, who is also in a very emotionally vulnerable state.
Exactly.
Yeah.